Hello, Global Mental Health students. My name is Meryl Pine, and I'm going to be presenting on depression and stigma around the world. Before we get started, I would like to make sure everyone has a little bit of background knowledge on depression. Currently, there are almost 8 billion people in the world. And according to the World Health Organization, 450 million of those people are suffering from a mental disorder right now. 322 million are suffering from depression. That is 4.4% of the entire world population. This is an increase in over 18% in the last 10 years. Right now, mental illness accounts for 12% of the global burden of disease. That's over $1 trillion in lost productivity per year. Depression negatively affects how you feel, the way you think, and how you act. Some symptoms include feeling sad, having no interest in activities that you used to enjoy, a loss of energy, and changes in sleep or appetite, whether that be an increase or a decrease. Despite mental illness being a leading cause of disability globally, almost 70% of people do not seek professional help. How is this possible? Stigma is the negative stereotyping of a certain group, such as those with mental health disorders. Stigma negatively impacts help-seeking behaviors, having adequate care, and overall quality of life for those with mental health issues. According to the World Mental Health Survey, which was administered in Colombia, Mexico, the United States, Belgium, the Netherlands, France, Germany, Italy, Spain, Ukraine, Israel, Lebanon, Nigeria, Japan, China, and New Zealand, stigma was perceived in 14% of those surveyed who stated they had mental health diagnoses. Physical conditions and disabilities were much less likely to have perceived discrimination and embarrassment around diagnoses, while comorbid mental health diagnoses, such as depression and anxiety, were almost twice as likely to be associated with stigma. Today, I would like to help you understand the prevalence of depression and the burden of this disease worldwide. I would like to take a look into the stigma and other barriers to care faced by those who have depression. As you can see, according to the World Health Organization, there are currently 322 million cases of depressive disorder. Currently, the African region accounts for 9% of those cases, coming in at just under 30 million. The Eastern Mediterranean accounts for 16%, coming in at almost 53 million people. Europe accounts for 12% of those cases. The Americas accounts for 15%, and the Southeast Asia region, combined with the Western Pacific region, accounts for 48% of cases. Of the nearly 1.4 billion, yes, billion people living in India, about 56 million people have depression. These people are not getting the support and treatment they need, which contributes to the very high rates of suicide. In 2012, 135,445 people committed suicide. That's an average of 371 suicides daily. For men, the main cause was unemployment or professional pressures. For women, it was family conflicts and domestic violence. And for elderly, suicides were caused by loneliness and family feuds. There was a survey of 3,556 people from various cities in India, and 47% of them reported being highly judgmental of people with mental illness. 26% stated they were scared of those they perceived as having mental illness. India is a country that has an incredible amount of stigma. 60% thought that mental illness was caused by a lack of willpower and discipline, and that the mentally ill should be quarantined. These people are not getting the help they need due to India only having 5,000 psychiatrists and about 2,000 clinical psychiatrists. India needs adequately trained professionals and facilities to treat patients. They need a healthier work culture and educational programs to decrease their stigma. As you can see, stigma around mental health issues is a worldwide problem. But focusing right now on Asia and in particular Japan, there are also very large issues in these areas. In Asia, you can see that 3 airlines will not allow passengers on board without a psychiatrist if they have a mental health diagnosis. In Japan, places such as museums and gyms do not allow people with mental health diagnoses in. The Japanese culture is very focused on success and perceived happiness. Additionally, shame is a large part of their lives. Shame-induced suicides is a very large concern. In Japan alone, there is a suicide rate of 60 per day, or 21,000 per year. Keep in mind that Japan only has a population of 127 million. Currently, in Japan, suicide is the leading cause of death for females aged 15 to 34. Japanese people are expected to work to the point of exhaustion and succeed at work, all while looking outwardly happy at all times. They work long hours, and this pressure can be too much. Mental health issues are negatively thought of, and most diagnoses are written off as bad personality traits or poor parenting. Being nervous or weak or not strong-willed is not what causes depression, though. The World Mental Health Japan survey showed that there were major barriers to care in Japan. Most notably, stigma and people wanting to take care of the problem by themselves. In Japan, people thought that the problem would go away or that they couldn't get the help they needed without being stigmatized by those they worked with. More structural barriers to care were that people did not know where to go to get help and were scared to ask for help due to the attitudes around mental health. Depression is a concern worldwide in both countries that are developing and those that have become developed. In Africa specifically, many countries are still developing and have large treatment gaps, as large as 98% of those who need treatment are continuing to go untreated. In South Africa alone, a 31% prevalence of depression was found. 60% of those people did not seek help. There is a stigma of mental health issues that plays into this, but these people also do not seem to understand the disease and the fact that it's treatable. While it is treatable, there are only 1.4 mental health workers per 100,000 people. So finding that help is very difficult. Having a physical comorbidity such as tuberculosis was associated with seeking help, as the patient was already interfacing with professionals and did not need to have to go find places for support. Geographical location also plays a part, as living further from primary care offices increased the likelihood of untreated depression, as traveling and having other responsibilities are barriers to care. As you can see, the rates of depression are continuing to increase throughout the years in the United States. Currently, the US has a population of about 327 million people, and 7% of those, or 17 million people, had a major depressive episode in the last year. 65% of those people are not receiving treatment. This is partially due to the fact that the US has only 28,000 psychiatrists. While the US has made incredible progress, and that is credited to anti-stigma campaigns and increasing access to care, there is still an unmet need in our developed country. Cost and payment of services is the #1 reported barrier to care in the United States. We need to work to increase access and the availability of professionals. Anti-stigma campaigns have made a large dent in the barriers to care, but there are still many people in many areas of the United States who think negatively of those with mental health issues. More education and increased anti-stigma campaigns can help. In one specific area of the United States where there's still a lot of stigma is those who work in first response roles and in the military. For a disease that impacts such a large number of people globally, there are very few people actually being treated for depression. According to the World Health Organization, fewer than 50% of people living with depression actually receive treatment. There are many barriers to this treatment, but stigma is one of the largest. Additionally, barriers include location of providers versus location of patient, the availability of providers, as there is a low number of psychiatrists per patient. Payment of services is a concern in both developing and developed countries. Not knowing where to find help is a frequently reported barrier to care because people are concerned about asking where they can find help because they don't want people to know that they have mental health issues due to the stigma. Transportation and time off of care are logistics that are also barriers to care. Finding childcare while parents access services can also be a barrier. Depression is the leading cause of disability worldwide, but as you can see, mental health, which includes depression and other diagnoses, is only receiving 0.3% of total health funding. According to the World Health Organization, the best way to provide care to those who need mental health resources is through an integrated primary care and community health approach. This increases access to prevention and treatment, which has taught us that up to 60% of people can fully recover. However, more than 40% of countries have no mental health policy, and over 30% of countries have no mental health program at all. More than 33% of countries use less than 1% of their health budget for mental health, and another 33% use exactly 1%. That is a combined 66% of countries worldwide who are using 1 or less percent of their health budgets for mental health. And this is for mental health, not specifically depression. More than 25% of countries do not have the most commonly prescribed medications for treating the most common mental health conditions. And in over 50% of countries worldwide, there's only one psychiatrist per 100,000 people. Depression is not a rich person's disease or a poor person's disease. It is an every person disease. It's a worldwide epidemic and it's continuing to grow. Currently, 450 million people are suffering from mental health disorders worldwide. And of those 450 million, 350 million are diagnosed with depression. It is, and by 2020 is expected to still be, the number one cause of disability globally. Due to the large number of untreated depressed people, our number of people dying by suicide is also very large. It's the second leading cause of death in 15 to 29-year-olds. Stigma is still a major barrier to care in all of the countries that I have visited in this research. Education and anti-stigma campaigns are important ways to combat stigma as a barrier to care. If we can get everyone talking about mental health and have it integrated into primary care, it will be commonplace and everyone will be accessing care just as everyone accesses care for physical health. Thank you for your time and listening to my presentation on depression and stigma worldwide. I hope you all have a great summer and thanks for a great semester of global mental health.